there's the patellar ligament and tendon. So if it goes from a muscle to a bone, it's a tendon. If it goes from bone to bone, it's a ligament. What you've got is the quadriceps muscle group on the front of your thigh has one tendon that comes to the patella. Patella is a sesamoid bone. It's inside that tendon, but often when you continue on from the patella to the tibia, we call it the patellar ligament. Cruciate ligaments, that means crossing. These are inside the joint. So if we look from the front, and the patella would be about here. There's the tibia. They make a little X in the middle. They're called anterior and posterior, ACL and PCL for short. Okay. And that's which one's in front, which one's in the back. On the sides are the collateral ligaments, lateral for side. You'll see them called medial and lateral, or tibial and fibular, for which side they connect to. Tibia is medial, fibula is lateral. I think usually in abbreviation they still use MCL and LCL rather than TCL and FCL. But it's been a while since I've been to physical therapy and talked about that, so it's possible they're working on shifting it. Okay. So this is a posterior view of the knee. The only thing we can see clearly is the fibular collateral ligaments. The tibial is mixed in with this giant joint capsule, and everything else is covered. And we can see little bits of muscle that connect in. This view is the anterior flexed. So we're looking at the distal or inferior surface of the femur here. We can see anterior and posterior cruciate ligaments there, patellar ligaments, medial collateral, lateral collateral, and then this is the menisci. And again, lateral and medial meniscus. Questions on knee structure? So our last thing is the clinical application on joint disorders. A sprain is any kind of damage to the connective tissue in a joint, either torn or overstretched. This can affect the cartilage, but is often ligaments or tendons. Arthritis just means joint inflammation. Itis is inflammation. You'll see that used for a lot of different things. The most common type is actually listed second here, osteoarthritis. It means bone arthritis, but it's really the cartilage that's affected. Over time, the articular cartilage gets damaged and wears down. It only has that synovial fluid to provide it nutrients, so it doesn't heal very quickly. And small amounts of damage can build up over time, make a rough surface that catches, or just thin it out, which can lead to the bones rubbing together. Rheumatoid arthritis is an autoimmune disorder, which means your immune system is attacking the joints. It's mistaking it for some kind of infection. Arthritis that is from an infection is Lyme disease, where the immune system fighting the bacteria makes these clumps that get deposited in the joints. This illustrates a healthy synovial joint and comparing osteoarthritis and rheumatoid arthritis. So in osteoarthritis, most of the tissues are fine, but the cartilage is worn down. And in this illustration, there's no cartilage left on those surfaces, just a little bit at the edges. The bones are touching. In rheumatoid arthritis, the articular cartilage is fine. This is shown in red for inflammation in the joint, which includes swelling and pain. And the bone itself can actually be damaged by the attack. Questions on arthritis?
I have a question.
Yes.
When you see like older people where their fingers have curved, like they...
Where they're just kind of stuck like this. Often that comes from, most often it's osteoarthritis with age. And if you don't use the joints, they get stiffer. And usually the muscles for flexion are stronger than the muscles for extension, so things will end up flexed. There's also one that is usually called foot drop, but that makes it sound like it's just weakness, when actually what's happening is the plantar flexion muscles have tensed up and caused permanent pointing of the toes. And that's something that often happens with people who are bedridden. All right, so that is the end of the chapter. So pause the tape.